Port placement overview. Port placement is a procedure that is commonly performed for long-term intravenous access. A port placement surgery is a minor surgery that implants a port, catheter, and connects it directly to the vein to allow for easier, reliable, and direct access to it. A port is common for IV therapy, small veins to prevent multiple pokes, or if a port is required for an IV treatment, chemo port placement. Port, also called a port-a-cath or metaport, placement is a common procedure for both interventional radiology and surgery. Port placement can vary with complexity, but tends to be a simple procedure often performed in the outpatient setting. Vascular access is conventionally, although not always, obtained through the internal jugular vein with the port reservoir placed over the chest wall ipsilateral to the vascular access site. A cornerstone of the port placement procedure is appropriate and efficient vascular access. Port placement pre-procedure prep indications. Most commonly long-term venous access for chemotherapy, blood withdrawal, contrast injection, antibiotic therapy, administration of blood products. Funnel-shaped ports that accept an 18-gauge IV needle has been used for RBC exchange and plasma exchange, total parenteral nutrition, TPN. Contraindications, infection and/or bacteremia, neutropenia, uncorrected bleeding diathesis. SIR paraprocedural coagulation parameters, INR. Correct to less than 2.0. Platelets. Less than 50,000 per microliter recommend transfusion, APTT. No consensus. Pre-procedural evaluation, H&P, labs. INR, platelets and hematocrit not routinely recommended. Review prior imaging for anatomic variants and SVC patency. Hold bevacizumab, Avastin, for 2 weeks before and 2 weeks after port insertion. Anatomic considerations, history of venous occlusion, multiple prior vascular lines, prior upcoming surgery such as mastectomy, chest wall post-radiation treatment.